Hi, I'm Mary Wong. Welcome to Fertility Talks, and I'm the founder and director of Alive Holistic Health Clinic, author of Pathways to Pregnancy, and your acupuncturist and fertility strategist. Today, I'm super excited to bring on air, hopefully, Dr. Marjorie Dixon, because hopefully she will appear and say hello. And when she does, because we're of course experiencing technical difficulties, I'm assuming that maybe there's something going on with Facebook. But Dr. Dixon, if you are there and you can see me on your live feed through Alive Holistic Health Clinic, then
I'm going on to Facebook. Is that what I'm doing?
Yeah, go onto your Facebook. So as you can tell, guys, we're having technical difficulties, so we're going to figure it out and we're going to make it happen. Because we normally use a third-party Zoom, and unfortunately, Zoom's connection to Facebook, there is an issue. So I don't know what's happening. It's like completely blank. But we're like, the show must go on.
Feed, Mary Wong?
So if you just go on to Facebook, so Alive Holistic Health Clinic.
I have it here.
Okay, so if you go onto the feed from that, do you see me going live?
I don't see. I don't know where to go on live, Mary Wong.
So you don't go live. It's just like whatever my feed is. It should actually be simultaneously going on.
6 minutes ago.
It says 6.
Started?
No, it just started. Okay.
Oh, you're live. I see you. I see you.
You see me live?
Watch.
Okay, so all you have to do is comment and say hello. And then I can...
Safari can open because the address is invalid.
What?
Comment, I'll say hello.
So if you're able to go on to comment onto my live feed, then I would be able to bring you on the screen. This is crazy, guys, but this is what we do in times of COVID. You should have just came over to my house.
I should have, but then I wouldn't be socially isolating.
Yeah, that's right. Well, we would, sit 2 meters apart. So, not seeing it? You don't see the live?
Nope. I see live video feed, but it won't let me press on it. But listen, we're talking tonight about what people can do as they wait for their IVF cycle to start, and it's an important conversation to have. But if we have such technical difficulties, we might not have any option. Let me try again.
Okay. So, it's funny, but I think people can hear you because we're going through, I can hear you through my computer as I'm going live on my cell phone. So there are people with eyes here and they want to hear you, and nothing's happening. So we could just, use your voice. Oh, people are losing some interest, but oh my gosh.
Yeah, I think that Alive Holistic Health Clinic, Mary Wong, I'm going to try one more time, but if I can't get in, I can't get in.
Okay. But you do actually see me like talking right now?
No, I don't see. You're frozen. It says live and you're doing nothing.
Oh, well, it's live at this end. But maybe if you do you follow my page? If you don't, then maybe it doesn't show up on your feed. If you like my page. Anyway.
Okay, let's see.
Okay. So there's a couple of people just hanging out waiting for you to turn on, but hopefully we can do something. Oh my goodness. Challenges. I might just have to erase this post altogether. But hopefully I don't have to.
Wow. Okay.
Okay.
I see you.
You see me?
Good.
You see me actually talking?
I saw you for a minute and then...
You got so excited. I was excited.
But hopefully I don't have to. I see you.
Okay. So there's the delay.
I do see you talking now.
Okay, so you can comment. Make a hello and comment. So there's a delay. Yeah, so you see me.
There's a delay, but I still hear you. So there's a delay. I do see you. Okay, so you can comment. Make a hello and comment.
Okay. So are you able to make a comment? because I can pull you up through you commenting. Oh my gosh. Let's get you in. Wait, it says, it doesn't give me a green go ahead. Oh my gosh. I like your comment, and then how do I get you on? They lied. They lied. I can't even get you on. It says, it doesn't give me a green go ahead. Oh my gosh. Okay, wait, maybe I'm going to switch the... Okay, so Marjorie, Dr. Dixon, I cannot get you on live. This is ridiculous. Okay, so we're going to reschedule this, guys. I am so sorry. I'm so sad. There are like 11 people sitting here waiting to watch us talking about ducks lined up in a row. And,
Mary,
yeah.
Why don't you try, if you want, just turn the camera towards me. Do back and forth turning, if that works. I'm so sorry. I'm so sad. There are like 11 people.
Okay. Yeah, you're right. This is an option. Okay, so let's do this. This is insane. Oh my gosh. This is ridiculous.
We can reschedule.
No. You know what? It's okay. It's just that it's not going to let me, there. This is funny. Okay, guys. So we're talking with Dr. Marjorie Dixon here, and we have to use a whole different way of doing this. So it's like literally my cell phone onto my computer doing a Zoom call, because right now Zoom is not letting me go on Facebook. So the show must go on, I guess. We are keen. And I can't even turn my camera to landscape, because once the camera's on, you can't turn it.
Okay.
So, a bunch of challenges.
Comes opportunity, Mary Wong. Out of adversity comes opportunity. We will figure it out, and we will get our message out.
Exactly.
So.
Yes. So this is Dr. Dixon, everyone, and you might already be familiar with Dr. Dixon. She's been around, and let me actually formally introduce you, as we've been having technical difficulties and you've been hearing both of our voices. So Dr. Marjorie Dixon is the CEO and founder of Anova Fertility and Reproductive Health, and has been practicing medicine 20 years plus, and poses a specialty in reproductive endocrinology and infertility. As a recognized expert in her field, Dr. Dixon is often asked to comment on newsworthy topics related to women's health in the media, such as Cityline, which you're actually going to be talking on tomorrow, right? Is that correct?
Yeah, tomorrow. That's
so
correct.
Cool. And for those of you who do not know, this is actually Canadian Infertility Awareness Week, as well as National Infertility Awareness Week in the U.S. So this is a really timely time to address what we're going to talk about today. I love the title, Ducks in a Row. So, yeah. So thank you for making the time, and thank you for persevering so that we can get this on, because it's an important conversation.
Yeah, absolutely.
So there's a delay, I just noticed, because from the Facebook to the Zoom, there's going to be a delay. And so that's okay. So everyone bear with me. All right, when I ask questions, there's going to be like a 2-second delay. So very first thing is, we all know that the fertility clinic is closed in-house, pretty much, not fully, right? So tell us, if I'm that fertility patient, what can I do right now to be ready when the clinic is open?
Okay, so, this has been an unprecedented time for us with the COVID-19 coronavirus COP2 situation. And it's been a public health crisis of pandemic proportions, because it crosses different continents, and now it has reached North America. In the assisted reproductive technology community, in the fertility community, this has had had worldwide effects, and clinics worldwide have been closed for the first time ever. So we as medical directors and fertility specialists are now communing because we recognize that we have a civic responsibility to flatten the curve and close, which is why we are closed. But we also recognize that our patients are feeling otherwise disenfranchised and now have this pause, an obligate pause. And what can you do during this time such that when we do eventually get the green light, because we will come out on the other side of this eventually, we just don't know when. So what can you do while you're at home during this time, or you're socially isolating and you're doing what you need to do for the greater good of public health? What can you do for your fertility to prepare yourself such that when the time comes and we're all given the green light in each of our individual jurisdictions to proceed with whatever therapy you have organized, we have you in the best possible place to proceed with your fertility treatment. So one of the things that you can do, and you know that though we are not physically in the clinics, the doctors are now doing telehealth visits like this, which hopefully go better technologically than tonight. But we are doing visits, video conferencing with our patients. And what I am finding is that patients are really wanting to elucidate or plan out what their therapeutic regimen will be when we get ready to go. So if you have been waiting to have a proper follow-up to know what your next steps are, if you haven't had a review from your initial appointment, if you need a regroup because whatever you were doing was not being effective or you have not managed to conceive, or even if there's any ambiguity in what the treatment plan that has been plotted out for you is, plan a visit with your physician at this time or your healthcare team, book a video conference, and tidy up that plan. Make sure that both your doctor and you are clear on what the path is ahead and that you have done everything that you need to do to have that clear plan and treatment protocol in your EMR, in the system in your office, such that when the time comes to go back, it's not like, okay, so can I have an appointment now to see my doctor? Can we discuss what needs to happen? Get your treatment plans organized now. And you can do that from the comfort of your living room. I see other people, like I am in my kitchen every day, or from their homes as they're socially isolating, so we can get that part done. So get your treatment plans figured out.
So are you seeing anybody at the clinic right now? I mean, some of the oncology patients, for example?
Yes, so we do. We have Ivf Cycles ongoing for the emergent patients, for our cancer patients. That was what our professional associations actually worldwide had recommended, because we got a lot. It was a constantly evolving situation, right, in kind of beginning to middle of March, and we were getting bulletins and telling us what they were recommending, and then finally kind of the hard close came around the 17th to 18th of March, when we were told the only people we should be doing is finishing the cycles that had commenced, and the only new cycles to begin are those who have potential cancer cryopreservation treatments pending. And so, or urgent, they're going on to chemotherapy for whatever reason. I have some patients who are going on to chemotherapy who have the need for emergent fertility preservation cycles. So those are the cycles that we have ongoing. Those are the only ones that is recommended for now, at least in our current jurisdiction in Canada, and in the province of Ontario specifically for me, for ANOVA. So we are not doing anything other than, yes, those cycles. We're not doing IUIs. We're not doing cycle monitoring. We're managing our pregnant patients. So if we have pregnant patients that are coming in with bleeding, we have ectopic patients, for example, that need surgical management and sometimes medical management, it's important that we not leave our patients in lurch, because there are some critical situations around fertility and assisted reproductive technologies that we must manage. We're not open every day of the week at all.
Right.
We're open 2 days, and we are open by appointment, because with social distancing and what we're understanding around COVID-19, it's critical that we take the appropriate precautions when we are bringing patients into the office and potentially exposing staff to patients and patients to staff. So we have pre-screening questions that we have on a telephone or via internet, so email. We ask those critical questions. Do you have a fever greater than 38 degrees or 100 degrees Fahrenheit? Have you had experiencing cough? Have you traveled in the past 14 days? Have you experienced any symptoms of diarrhea as well? If any of those hold true, the patients are told to stay at home and not come anywhere near the clinics. If those people pass those initial screens, then they come into the clinic specifically as they are asked to come up into the facility. They don't wait in the weight room. Our weight room is a through room. It's no longer a weight room. They go directly into their treatment place or have their bloods drawn or get assessed and then leave, and we follow up with another telehealth visit. So it's all virtual visits as much as possible. Again, at flattening that curve. That's our critical piece for now. But we are still managing to do any critical assessments. If you're a patient and you're pregnant, we're still doing ultrasounds for our pregnant patients. We have patients that we follow through the second and third trimester because we have obstetricians on staff as well at Innova. So we're seeing pregnant patients, so we have to be very careful about how we manage them from an infection prevention and a potential contraction situation. So we want to be able to ensure safety for our patients utmost. That's our number one, and then choose so that we can keep the ball rolling for those patients that have some critical testing that needs to get done, or if we're working with family doctors, sometimes they had things that needed to be followed up. So we're just doing it on an appointment only and with appropriate screening given the current circumstance.
You know, I really love it that you are addressing this, because I was literally having a virtual consult today with a patient. I'm going to turn this camera on to me for a second. And what happened was, she says, you know, Mary, I want to start trying to conceive again. And in my past history, I've had multiple miscarriages. So, you know, I'm humming and hawing about trying on my own because I know I can, but I'm fearful of getting pregnant and then maybe having that potential loss. And I know I want to get monitored. Right? So you addressing the ability for them to go into the clinic and get to taken care of the way they need to, because when you're pregnant, that is an essential service. Right?
Yes.
And I know it's controversial, you know, I mean, we might as well go there as well. It's controversial about, you know, is a fertility patient and the treatment essential? And, you know, anyone who's trying to conceive is going to say, absolutely, it's an essential service. But unfortunately, that's not the case from the outside perspective. Not right now. So, you know, you could probably address that more. But going back to the person that's trying to conceive right now, and the fear around, you know, oh my gosh, what if I get pregnant? Am I going to now be fearful of going into the clinics? And really, what I said was, gosh, like, I think you're way safer going to a place like Innova than going to the grocery store. Because the grocery stores aren't making you take these precautionary questions. They don't question you at the front door and say, have you had these symptoms? You just go into the grocery store, right? Mm-hmm. Just saying. So it's safe. It's safe to go in. And so now I would love for you to address that whole thing about the essential service or not in terms of fertility. Is that too controversial for you to address?
No, hey, look, I'm your lady. You know, I'll talk sometimes. I weigh in because they are real issues, and you know, they're critical issues that are impacting our patients. And when I'm doing these calls every single day on video, patients are saying things like, doctor, I want to go back to my treatment, and I don't understand why the LCBO, the Liquors Commission, is open, or I can buy a car, or I can, you know, go to pick up food, but I can't go see the doctor if I get pregnant. And I say, you know, it is not my job to question what public health has decided as the mandate for what is an essential or elective in medicine treatment at this time. Whoever is in public health has come to those decisions by virtue of the circumstance in our situation, in our jurisdiction, and what's going on with cresting that wave. Are we doing a good job with the more deaths every day? We have different responsibilities from the greater good and civic duty. So I hear both sides. I recognize that patients also say things like we have a right to autonomy and self-determination. But by the same token, I recognize that I'm a physician that's assisting with reproduction, and that means that we have a choice, and we do have a duty to do no harm. So beneficence and non-maleficence to our patients, it's an oath that we take. So we're walking a very fine line, and I think this is an unprecedented circumstance. It's of epic proportions. We've never been told to stay home, and we see what's happened in other places where they didn't have this social isolation mandated early on. So we have to recognize that as physicians, we do what is in the best interest of the greater good of the population. And much as we want to advocate, and actually right now, there is a patient advocacy group called Conceivable Dreams that has sent out a survey asking fertility patients to weigh in about their experiences and their concerns around the obligate pause that they are taking around their fertility care. And so that will be helpful because one, it's getting kind of an objective, measure across through a survey without it becoming overly emotional, but also getting a consistent idea of what the voice of the patient is saying, and then being able to relay that back to the people that can maybe make decisions about putting fertility care on the radar of something that is prioritized as we consider the how to and when to go back to the business of growing families safely. So I think having the advocacy group take essentially the pulse of the people and having a measured approach in presenting that as a concern and a relative priority for our patients would be the most effective and best way to address that issue, because my personal opinion really honestly doesn't matter. And honestly, I don't want anybody to have the perception that it's biased because I am a physician or because I am a clinic owner. It needs to come from patients. The patients need to advocate for themselves, and I don't want to just send them writing letters. I don't know where to send them. So now we have a place. If you go to Anova Fertility's Instagram page or anovalife.com, there will be a link to that questionnaire, the survey, and you can weigh in.
Oh, that's great. Thank you for sharing that. And so, the truth is, we're not going to be in this place forever. So when we do get back up and running, I imagine things will look different. And there can be a huge backlog of people that were wanting to do treatment. So how are you handling that? How are you prioritizing? What are we doing?
Yeah, so that's a big question. I think that's going to be very clinic dependent just as much as people's lists for funding or lists for IVF priority differs from clinic to clinic. I do believe the medical directors in the province locally and through Canada do converse and have had meetings about, who should be prioritized, how are we going to manage, and we're communing to the best of our ability and coming up with recommendations and guidelines across the board from not our governing bodies, but essentially the different committees that we are part of that make recommendations and guidelines for us, but it will be clinic dependent. I can say that from Anova's perspective, we are wanting to prioritize those patients for whom timeliness is key, and I sense that will be the practice across the nation and across clinics, because we recognize that putting it off is off-putting, and then also there is relative risk to starting a cycle 4 or 5 months down the line, right? We want to be sure that once we've elucidated a protocol or identified a protocol for our patients in whom diminished ovarian reserve is the issue or advanced maternal age is the issue, those patients where timeliness is key will likely be prioritized. Again, with, of course, the cancer patients, yes, who always are front line and front of mind when they are going on to chemotherapy, radiation treatments and need to go sooner rather than later.
Absolutely. So then are you looking at, so some protocols, if it's the long protocol, are you just like putting people on the birth control pill, or what are we doing?
Well, so it's not everybody. For the patients for whom it is safe and who it will not impact their stimulation protocol, we will be putting them on the pill, or we have been timing them in on the pill. There are other patients who have relative contraindications or absolute contraindications to the pill that we are not putting on the pill, that we are knowing when their cycles begin. So again, when you're talking about getting your ducks in a row, one is knowing what your therapeutic plan is and your protocol is. Two, making sure you've communed with your clinic to get all of the administrative stuff down pat. So make sure that your consent forms are signed. That can get done virtually as well. We at Inova recognize that the cost of cycles sometimes is a great barrier to patients. So we also have our finance department providing options for patients for financing, for payment in installments, for other options, understanding what people have in as much as their your benefits are concerned, because some patients are concerned where they're off, they're laid off, and they don't know necessarily that they'll be rehired. They have benefits. They want to tap into their benefits and get that secured. So it's important to identify those things and investigate them now and get them all sorted out now while you're waiting, so you don't feel like you're doing nothing as you wait. Know your treatment plan. Organize your consent forms and signing. Make sure your blood work is updated and up to date. Make sure that you have figured out the finance around your cycle, so that you know, even with funding, there are some pieces that are not financed. So make sure that you have organized all of those portions around your cycles. And then lastly, take care of your health and your mental health right now, because it's hard being in one place with the people that you love that can make you crazy constantly every single day. Find time for yourself to optimize what you can for your fertility. I know that I'm sure you're telling people about healthfulness. Make sure that your supplements are all in key. Make sure that if there is anything that you can do from a meditation and wellness perspective, that you do that. We, like you, have a wellness group, and I know that are also doing virtual consultations. We have all adapted to this new scenario, and we are here to support our patients. We haven't forgotten you. If anything, we're really adapting and listening to what it is that you need for us to do for you during this hiatus. And, I remember, Mary, you would tell me, you're like, I just want the patients to get, a month and a half to 2 months of a pause, so that they can get themselves organized from a health perspective and then go for their IVF cycle. This is it.
Yeah.
This is like a blessing in disguise. That's your silver lining of this time, because I recognize it's frustrating. Patients tell me, I had one patient who said, I know that there's a fertility clinic that's still open in Ontario, and I want you to tell me, and I'm frustrated. And I was like, I hear you, I see you, but there are things that you can do.
Yeah. Yeah, absolutely.
I just awakened my Siri in my thing, so she started talking back to me.
Oh, I didn't hear it. No, we're good. You didn't hear it at all.
Into my screen.
So that's funny.
We recognize, and that's why we started Inova Life. We built a patient women's health newsletter around fertility to support patients during this time, and reach out and provide silver linings and provide recommendations and updates about what's going on, and about when we can go and how we can go and what we can do in the interim. Just do all of the nitty-gritty stuff, so that when it's time to go, you're set.
Totally. I love it. And you've basically captured everything that needs to be captured. So I'm going to flip this back to me for a second. And so I love it that you talked about, the ducks lying in a row beyond the fertility clinic, because it is a time to reset. It's a forced reset. I mean, nobody wants to, but what a great opportunity to look at your health, mental and emotional and physical well-being. And right now, actually, you don't know this, but one thing that we're doing now, because guess what? People actually cannot go physically for acupuncture session as well. And we all know that there's a huge percentage of patients that are getting acupuncture, but not right now. So what do? So what I've been starting on is this thing called acupatching, which is so awesome. It's phototherapy. It's called photobiomodulation. And you take this patch, which has acrylic. I'm holding a cell phone looking at this, so I can't even grab one for you to see. Maybe I'll reach over. Oh, okay. So this one's called an energy enhancer. And it might be backwards, but the patch, it's so cool. And so within it, you'll see that there's this acrylic component. It's a material, and they've devised something like a recipe where they'll have these crystalline structures within, so that your body heat can basically, in the form of electromagnetic waves, gets reflected back through this patch. So we direct it at acupuncture points with a similar kind of behavior that an acupuncture needle would have. So really fascinating. I've been using it. I've been doing it on patients. Really, really awesome stuff. So if your staff is interested, I could totally share that with you, because it's like doing acupuncture at home without having to go to the clinic. So awesome right now because we can't go to the clinic.
Yeah.
So there you go.
And this is where we have an opportunity to innovate for what is required for our patient care, because we haven't forgotten our patients. We were caught off guard just as much as the patients were, and we are thinking outside of our box now so that we can still support you in spite of this honest, almost apocalyptic situation, right?
Totally.
So that is why it's so important for us to commune. That is why it's so critical with this Infertility Awareness Week to be talking about alternatives and to be talking about, reaching out, finding community, looking for supports, and the people in the clinics and the doctors and the clinicians and the other caregivers that are part of your team that are here to support you during this void. And getting the ducks in a row, I think, is a very empowering thing, because it allows you to take back control a little bit of a very out of control situation. And I recognize that with our fertility patients, that is so critical, case in point, to part of the success around the journey, right? So that's a little bit of my pontificating, but it's also what I recognize that patients, when I'm doing these interviews on a daily basis with the patients, follow-ups and new patient visits, when I say, you can't come in, we can't do this, we can't do cycle monitoring right now, we can't do IOS, there's a lot of can'ts, but there are things we can do. So let's focus on the things that we can do to get you through this.
Thank you. Absolutely. And, I really, again, I want to thank you for through these challenging times, which includes challenging technical times. We're still getting things. We are pivoting. This is we are literally living and breathing the ability to pivot, work through challenges and still come thriving. And we are delivering our information to you. Hopefully it'll empower you, and you can speak to your fertility clinic, right? Reach out to them so that you can make that plan. I've had some of this conversation with some other doctors, but I loved how you put everything through. And again, it's about balancing everything as well. So thank you for that, Dr. Dixon. I know you're very busy, and so tell us what you're doing for tomorrow. You're at City Line?
Yes, tomorrow I am doing an Instagram live on City Line because we're not taping in studio. So I will be taping from my living room, and I'm going to be talking about pregnancy and infertility in the COVID-19 era.
Perfect.
And what that means for patients. So it's timely. And I think that it's important to have a conversation, because often I also get from patients, well, we can't have fertility treatments, but my friends can have sex and have babies. Nobody's told people to stop. So what's with that? So we'll be addressing that tomorrow.
Awesome. Okay, thank you. And so that's City Line. And so I'm going to bring this back to me. So thank you so much for your time, patience, your love. And for those that do not know, actually, I'll tell everyone right now, Marjorie Dixon actually did my surgery, and I had gone through fertility challenges, and she has wonderful hands. So I know her intimately. I know her intimately, so I trust and love her, and
I know you inside and out, Mary. Sorry.
Now you're talking dirty. It's like anyway, so what's that?
Always a pleasure. It's always a pleasure. We've been on committees together. What I love about you, honestly, is that you are tried, true, tested, there for patients, always advocating, always working, looking to better people. You're a great human being, and the patients know it and sense it, and we're blessed to have you as part of our community, Mary.
Ditto. Likewise. Couldn't have said it better myself. Yeah, love you. And so thank you for being a part of this, and we will talk again for sure. And I'm going to thank you, and I'm going to turn this around back to me. This is so crazy. So thanks, guys, for watching. You scroll down. This is, I think, live post number 163. So you can scroll down and like the page for sure. And otherwise, if you're not a Facebook kind of gal, or man, then you can go to Meet Mary Wong on my YouTube channel, and you'll have all of everything there. And also, every 2 weeks, we are going on live during the day. Maybe Dr. Dixon will want to join us one of these days. But once a month, we're doing a fertility for hope, connection, community, bringing calm, right? All of that, and with very tangible advice. And we're also doing every other week a more generalized one, you know, for your partners, friends, people that don't get you, like just throw them on there so that we can help them as well. And that's during the daytime, Tuesdays, 3 p.m. Eastern Standard Time. So check that out. Contact us at Alive Holistic Health Clinic. And if you're interested in acupatching, definitely contact us as well, and we can give you more information on that. And so, yeah, have a great night. And this is the Canadian Infertility Awareness Week. So there's lots of stuff going on, I know. And as I said, or as Dr. Dixon said earlier, she's going to be on City Line tomorrow. We'll be doing more every week. So thank you again, Dr. Dixon, and we shall see you very soon. Take care, guys. Bye.